Kelsey, and I'm from the University of Pittsburgh School of Nursing, and today I'm going to be helping you learn how to do a cardiopulmonary assessment.
And I'm Morgan, and I'll be the patient.
Hi, Ms. Lacko. I'm Kelsey, your student nurse today, and I'm going to be assessing your lungs. Is there anything you want to tell me about your breathing before we begin?
No, everything's normal.
Okay. One thing you need to be able to do to pass the exam is actually examine your patient. This patient is awake, alert, oriented, no signs of respiratory distress. Earlier we took her pulse, respirations, and blood pressure. They were 70, 110/70, and 15. When you're actually examining a patient, you have to stop and look at the patient. The patient's AP to lateral diameter is 1 to 2, not barrel-chested. Her chest is symmetric and there are no deformities noted. And to do this, you have to find the level of T10. So you start by finding C7, which is like the big bump when you bend your neck over. And then you just count down, starting at T1, and then you feel all the bumps and gaps until you get down to T10. So T1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So first you find C7, which is the big bump when you bend your head, and then you just count down from there, starting with T1, and then you feel all the bumps and gaps until T10. So T1, T2, T3, T4, T5, 6, 7, 8, 9, and 10. So you start with C7, which is the big bump when you bend your head, and then you just work your way down, starting with T1, and then feel all the bumps and gaps till T10. So T1, T2, 3, 4, 5, 6, 7, 8, 9, and 10. So around the level of T10, to test for lung expansion, you're just going to take your two hands and push the skin together until you get some folds, and then please breathe in. Let them expand out, and then let it out, and see the folds come back. So about the level of T10, just put your hands and then pinch in until you get some folds of skin, and then breathe in. Let them expand out, and let it out. So now we're going to test for tactile fremitus. So when I put my hands on your back, just say 99, okay?
Okay. 99.
Can you please say 99?
99.
And again?
99.
One more time.
99.
So now we're going to move on to auscultation, and a few common mistakes that students make is, one, they start in too close to the spine. You should be halfway between your spine and your shoulder here, so right around here. Another mistake is they start too low. You have to listen to the apex of the lung, so you want to start with your stethoscope up here. And also, students don't listen to both inspiration and expiration, so make sure that you take your time. So I'm going to be listening to your breath sounds now, so if you could just hug yourself so I can get your back area. Okay. And when I put the stethoscope on, you just take a normal deep breath in and out, all right? So you start up here, and this is your first spot, and this is the right upper lobe, and you should hear vesicular breath sounds. And then you go on to the other side, same thing. And now we're in the left lower lobe. So vesicular. You could just slow your breathing a little bit down to normal. Thank you. Good. So you should have 7 points on each side. So now we're going to auscultate anteriorly. So I'm going to just do the same thing on the front. If you could just breathe in and out normally, all right? So right upper lobe vesicular breath sounds. Left upper lobe vesicular. Left upper lobe vesicular. Right upper lobe vesicular. Right upper lobe. Right upper lobe vesicular breath sounds. Left upper lobe vesicular. Left upper lobe vesicular. Right upper lobe vesicular. Right middle lobe vesicular. Left upper lobe vesicular. Left middle lobe. If you make a mistake like I just did in the exam, just say, I made a mistake, and just keep going and correct yourself. So, left upper lobe vesicular. Right middle lobe vesicular. Right lower lobe vesicular. Left lower lobe vesicular. Left lower lobe vesicular. And right lower lobe vesicular. You learned in class that you can hear bronchovesicular sounds in different areas, but what you should say is what you actually hear. So now you would listen to the lateral side of the right lung, and I'm just going to show you where you place the stethoscope. So you'd go here, here, and there for all 3 lobes, but on the real exam you should be going under the clothes and right on the skin. Your right upper lobe, right middle lobe, and right lower lobe. So now you do the same thing for the left side, only here we have no middle lobe. So you start and you would do left upper, left lower, and left lower. But once again, it would be under the clothes. So now we're going to be moving on to the cardiovascular part of the exam. Ms. Zarako, we're going to be examining your heart next. Do you have any problems with it? Anything you'd like to discuss before we begin?
No, I'm good.
Okay. So to auscultate the heart, you start by finding the sternal notch, which is the little divot in your neck, and then you go down until you feel the bump, which is the sternal angle, and you follow that over to the right, and that brings you to your second rib. And when you go down, that little space there is the second intercostal space, and you start listening there. The second intercostal space in the right, or the aortic area. So you just listen. And then bring it over to the left, which is the pulmonic area. And then feel the divots down. So this is the third intercostal space. And then come up from the bottom to get the fourth or tricuspid area. Fourth intercostal tricuspid area, fifth intercostal tricuspid area, and then fifth at the midclavicular line is the mitral area. And then move over to that fifth intercostal space or mitral area. Then you turn the bell of your stethoscope on, and you're going to listen for any S3s or S4s over the mitral and tricuspid areas. So, mitral. They're equal and 2 out of 3. Next, you're going to find the carotid pulse, and remember to stay low and don't find it up here. Now go to the other side. The carotid is equal on both sides and a 2 out of 3. So next you're going to feel for a brachial pulse. 2 fingers. Pulses are symmetrical on both sides and a 2 out of 3. However, on the exam, as in real life, if you can't feel it, say that you can't feel it and go get a Doppler. So now we're going to find the radial pulses on both sides. So just go down from the thumb. Pulses are symmetrical on both sides and a 2 out of 3. So now we're going to find the femoral pulse, and to do this, take a gloved hand and go under the clothes. And to show you placement, I'm just going to show you right now. Just right there. And right there. So now we're going to take the posterior tibial pulse, and remember to ask the patient if you could take their socks off. Can I take your socks off?
Certainly.
Thank you. Okay. So one trick to find this pulse is to take your 3 fingers and put them right over the bone and slide them down into the crevice. And you'll feel it. Pulses are equal on both sides and a 2 out of 3. And once again, if you can't feel it, get a Doppler. A helpful hint to find any pulse is to use the pads of 3 fingers, and you'll get a wide area to feel it with. So now we're going to find the dorsalis pedis pulse. So just take your 3 fingers on the foot. Other side. Pulses are equal on both sides and a 2 out of 3. And if you can't find it, just say so and get a Doppler. So now we're going to assess for color, sensation, and movement in the extremities. And the first thing you look for is color. And based on your patient's ethnicity, just describe what you see. It could be like a pink or a warm brown or pale, whatever you see. And just make sure that it's the same in both feet. And next you're going to assess for sensation and ask the patient if they have any pins and needles or tingling or anything like that. No? Okay. And then ask and see if they can feel when you touch them and try and trick them a little bit. So, can you feel me touching you now?
No.
Can you feel me touching you now?
Mm-hmm.
Can you feel me now?
Yes.
What about now?
No.
Now?
Mm-hmm. Yes.
Okay.
Yes.
Okay. And then to check for movement, see if they can wiggle their toes, move their feet. Okay. And then the last thing is just temperature. So you just feel with your hand like this. Make sure it's equal on both sides. So the patient is cool to touch, but symmetrical.